Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And today I wanted to talk about a very important topic and something that is underemphasized within our nation, and that is racism. Racism is not only a problem, but a pervasive problem within our society as a whole. Um, Everything from police interactions to mental health interactions with the general population, with medical and medical attention is different between African Americans and Caucasians. So I'm going to go over that quickly. This was actually published in the New England Journal of Medicine and talks about the pathology of racism, a call to desegregate teaching hospitals. And I've experiences in family and whatnot. It's a travesty that this is still an issue. And when we're thinking about um, the types of interactions that take place in the context of racism, um, some of this got integrated into Black Lives Matter. But the reality of the situation is that anything that was 2020, well, now it's behaving like we're still in the 1950s, before Brown versus Board of Education, and before some of the important legislation that took place to try to provide more inclusiveness within the context of race. Um, so there's actually two or three incidents um, that are stated after the tragic death of George Floyd. And so this was the impetus for the proclamation of commitment to Black Lives Matter. The hospital system, again, is not equitable. There's high quality of care, but when it comes to communities of color, this same equitable care does not translate um, to this one. Um, so the part of this actually did come from an email, and the comment was made that the treatment of African Americans still are relevant in the 1950s, from the 1950s. Also, there's gloating, where white patients are exposed to advanced pathology, whereas black patients are not. Another aspect that is seen in terms of segregation is the difference in billing. It's called the billing thing, and that was it. That's just the way things are. You don't question. You just take it as it is. What does this divide mean for patients? Well, several studies indicate that residents under attending supervision do not actually provide worse care than attendings, but a focus on objective quality measures overlooks the implicit message that this segregated system sends to patients that they exist to be trained on. So we need to naturalize inequality rather than spend so much time trying to understand it. With this, I want to transition onto another group of presentations that I conducted. And this one I was actually talking about, and I'll display the slide, understanding race during National Public Health Week. And this took place a number of weeks back, but understanding how precisely composite factors of health and social factors impact communities, utilizing Healthy People 2030 to activate social determinants of health. And of course, this is a framework with 5 domains, which include the built environment, proper health, proper education for all, and integrating more of a contextual framework so that varied geographic, race, and social indicators can be combined to create a better overall understanding of the community. And I would take this further and try to provide mental health, SBIRT, and some of these other interventions to try and help individuals that may not only have substance use disorder and other mental health illnesses, but also understanding the gravity of schizophrenia. So it's important to be not only educating the healthcare practitioners, but also administrators at level of administration, the CEO, and other organizational leaders need to be made aware of the problem of racism that is still at the forefront of how health is treated. Thank you for listening.